Bismillahirrahmanirrahim. Today we will discuss about the rheumatoid arthritis. So rheumatoid arthritis is an autoimmune condition, disease. It is an autoimmune disease. The cause of rheumatoid arthritis is unknown, but an infection, environmental changes, and genetic factor can trigger the immune reaction against the joint, and these immune reaction not only affect the joint but it can also involve the other organs. So cause is unknown, but infection, environmental changes, and genetic factor can trigger the immune reaction. So any infection can trigger the immune reaction and can cause the rheumatoid arthritis. But one infection, that is Proteus mirabilis, is known to cause the rheumatoid arthritis. Similarly, the gene which is responsible are the HLA-DR4. This gene is associated with the rheumatoid arthritis. Rheumatoid arthritis can occur in male as well as in female, but this condition is more common in female. Female to male ratio is 3:1. It is 3 times more common in female as compared to male. Rheumatoid arthritis can occur at any age, but more commonly it occurs in age 30 to 50 year of age. Rheumatoid arthritis is not only an arthritis. It is not just an arthritis. It is a multi-system disorder. So it can involve the joint. In the joint it will cause the arthritis. It can involve the eyes. It can involve the skin. It can involve the blood. It can involve the heart. It can involve the lungs. And it can involve the nervous system, and also the renal system. So it is not just an arthritis, but actually this is a multi-system disorder. Now in the joint it can cause the arthritis. Joint involvement means arthritis. Rheumatoid arthritis causes the symmetrical arthritis, means both hand and both feet will be involved. Symmetrical arthritis. It causes erosive and deforming arthritis. Erosive and deforming arthritis. The most common joint involved is the MCP and PIP joint. MCP means metacarpophalangeal joint in the hand, PIP joint in the hand, and wrist joint. These are most commonly involved joints. Now in the hand there is one joint which is not involved in the rheumatoid arthritis. That is the DIP joint. Distal interphalangeal joint are not involved. in rheumatoid. So condition which involve the distal interphalangeal joints are two. One is the DIP joint involvement occur in two conditions. One is the psoriatic arthritis, and the other is the osteoarthritis. These are two conditions which involve the distal interphalangeal joint. Now in the spine, it can involve the cervical joint, cervical spine joint, spine joint. That is why people with rheumatoid arthritis should avoid the yoga exercise. Or when this patient is undergoing some surgical procedure under general anesthesia, then X-ray of the cervical spine should be done before the anesthesia, because during anesthesia there is a hyperextension of the neck and it can cause the atlantoaxial subluxation, due to which there will be cord compression and the patient may go into quadriplegic state. So X-ray should be done. X-ray of the cervical spine should be done before general anesthesia. General anesthesia, to avoid atlantoaxial subluxation. Atlantoaxial subluxation. And this patient also avoid the yoga exercise. Now in the spine, the lumbar spine joints are not involved, and the same is true for this sacroiliac joint. These two joints are not involved in the rheumatoid arthritis. Lumbar spine joint plus sacroiliac joint. These two joints are not involved in the rheumatoid arthritis. Now we know that rheumatoid arthritis causes the erosive and deforming arthritis. So what is the difference of arthritis of SLE and rheumatoid arthritis? Here is the difference. SLE arthritis and rheumatoid arthritis. SLE arthritis causes non-erosive and non-deforming arthritis. Non-erosive, non-deforming. Non-erosive and non-deforming arthritis in SLE, while rheumatoid arthritis causes the erosive and deforming arthritis. Now, patient confuse the rheumatoid arthritis with the rheumatic arthritis. So what is the difference between the rheumatic arthritis? Means the arthritis which occur with the rheumatic fever, that is rheumatic arthritis. So the difference between the rheumatic arthritis and rheumatoid arthritis. The difference is it causes the rheumatoid arthritis causes the symmetrical arthritis. Symmetrical arthritis. And erosive and deforming. While the rheumatic arthritis causes the migratory arthritis, that is the jumping arthritis. One joint arthritis occur, that joint become better and the arthritis jump to the another joint. This is called the jumping arthritis or migratory arthritis. Also, this is non-erosive and non-deforming arthritis. Non-erosive and non-deforming arthritis. So this is the difference between the rheumatic arthritis and the rheumatoid arthritis. As we have already discussed that rheumatoid arthritis is a multi-system disorder. We have discussed the arthritis. Now we will discuss the eye involvement. These are the extra-articular manifestation of rheumatoid arthritis. It can involve the eyes, skin, lungs, heart, renal, blood, and nervous system. So, what are the extra-articular manifestation? Eye involvement. In eye, it can cause the keratoconjunctivitis sicca. Keratoconjunctivitis sicca. This is the most common eye manifestation. Most common. MC is for the most common eye manifestation. Second is the scleritis. Scleritis. Third is the episcleritis. Fourth one is the scleromalacia. Scleromalacia. Since rheumatoid arthritis patient takes steroid, so steroid can cause the cataract. Steroid-induced cataract. And these patients also take a DMARD, which is called the hydroxychloroquine. And hydroxychloroquine can cause the retinopathy. HCQ-induced retinopathy. While steroid cause the cataract. Steroid. Now about the scleritis and episcleritis. Scleritis is painful condition. While episcleritis is painless condition. So these are the eye manifestation of rheumatoid arthritis. In the skin, it can cause the ulcer, gangrene due to vasculitis. It can cause the livedo reticularis. And it can cause the subcutaneous nodule, that is rheumatoid nodule. So these are the skin manifestation of rheumatoid arthritis. Now what are the pulmonary manifestation of rheumatoid arthritis? This include the pleuritis, pleural effusion, pulmonary fibrosis, pulmonary nodule means rheumatoid nodule in the lungs with the coexisting pneumoconiosis is called the Kaplan syndrome. Means rheumatoid nodule with the pneumoconiosis. This is called the Kaplan syndrome. Now it can cause the bronchiolitis obliterans. This will show obstructive pattern on the pulmonary function test, while the pulmonary fibrosis will show the restrictive pattern on the pulmonary function test. And one thing about the pleural effusion is that rheumatoid arthritis with pleural effusion, when you take fluid from the pleura, there will be low glucose in the pleural fluid. Also the methotrexate, these patients take the methotrexate, and methotrexate can cause the pneumonitis. Rheumatoid arthritis will cause the fibrosis. These fibrosis will occur in the lower lobe of the lungs, while the fibrosis which is caused by the ankylosing spondylitis, it will cause the upper lobe fibrosis, that is the apical fibrosis. So these are the pulmonary manifestation of the rheumatoid arthritis. Now the cardiac manifestation of rheumatoid arthritis. The cardiac manifestation include the pericarditis. It can cause the myocarditis. It can cause the mitral valve regurg, MR, mitral valve mitral regurgitation. According to the Harrison, it can cause the mitral regurgitation. And since there is accelerated atherosclerosis in this patient, it leads to coronary artery disease. And this is the cause of death in this patient. Cause of death in rheumatoid arthritis is cardiac cause. So these are the cardiac manifestation of rheumatoid arthritis. The renal manifestation of rheumatoid arthritis include the secondary amyloidosis, Since rheumatoid arthritis is a chronic inflammatory condition, and any chronic inflammation can cause the amyloidosis. That will be the secondary amyloidosis. And if the amyloid deposit in the renal, the patient may present with the proteinuria. That is the nephrotic syndrome. Similarly, these patients use the penicillamine, and penicillamine can also cause the nephrotic syndrome. Also, these patients are associated with the membranous glomerulonephritis, MGN. Rheumatoid arthritis patient takes NSAIDs, and it can cause the AIN, acute interstitial nephritis, or NSAID-induced chronic nephropathy. NSAID-induced chronic nephropathy. So these are the renal manifestation of rheumatoid arthritis. Now the hematological manifestation of rheumatoid arthritis are sometimes the examiner asks the question, what are the causes of anemia in rheumatoid arthritis? So rheumatoid arthritis can cause any type of anemia. That is, the most common cause of anemia in rheumatoid arthritis is the anemia of chronic disease, because rheumatoid arthritis is a chronic inflammatory condition, so it is associated with the anemia of chronic disease. Normocytic normochromic anemia will be there. Normocytic normochromic anemia. This is the most common cause of anemia in rheumatoid arthritis. But rheumatoid arthritis can also cause the iron deficiency anemia. This is due to the chronic NSAID use. It will cause erosion of the gastric mucosa, and there will be chronic bleeding. Erosio gastric mucosa. And chronic bleed will lead to iron deficiency anemia. It can also cause the macrocytic anemia due to folic acid. Necrocytic anemia due to folic acid. Necrocytic anemia due to folic acid. Why this patient will cause the macrocytic anemia due to folic acid deficiency? And the cause is the methotrexate. Methotrexate is an antifolate drugs. Similarly, macrocytic anemia can also occur due to B12 deficiency. Macrocytic anemia due to B12 deficiency. Why this patient will be B12 deficient? Because of the associated pernicious anemia. Pernicious anemia. We know that one autoimmune condition always have association with other autoimmune conditions. So pernicious anemia is also an autoimmune B12 deficiency condition. So macrocytic anemia can occur due to folic acid deficiency, that will be due to methotrexate, and macrocytic anemia can occur due to B12 deficiency due to associated pernicious anemia. And also there could be associated autoimmune hemolytic anemia. And we also know that some of the DMARD like methotrexate and other DMARD can cause the bone marrow suppression. Bone marrow suppression. So these are the causes of anemia in rheumatoid arthritis.